back in November, I was hunting in Jeff City, and I watched an infomercial, and it was exactly what I needed in my life.
Tell me about the infomercial. I mean, okay, so you were sitting there, you woke up in the morning.
And it was early.
Tell me about that morning. Like, you woke up, just walk me through that morning.
Well, I woke up and we were getting prepared for a hunt that morning. It was the third or fourth day of the hunt. And I had some friends up from Texas. So we were hunting Jeff City. We only had local channels. We're used to cable at home. So I got interested in an infomercial on the Huntline Dental Group. And one of the employees' brothers had a procedure done that I was interested in doing for myself. So I went home and shared it with my wife. I didn't tell the guys that I was hunting with about what was going on. So.
Well, my name is Pam McNeil. I'm his wife. I also have been in the dental field for 30 years, retired from it now. Yeah. He came home and told me about it. With my background, of course, I'm
her skepticism.
Very skeptical, and even tried to talk him out of it. But we had been to oral surgeons, we've been to dentists, we had been to so many specialists, and the bottom line is he was going to have his teeth removed and go through life a while without any teeth before they could do anything.
And that just wasn't an option.
That wasn't an option. So when he told me what he had watched on this infomercial for Huntline, I said,
yeah,
I think he's probably a quack. And so I even talked to a couple of doctors I knew about it, and they advised against it as well. But the more I started researching into it and investigating, I got a little more open to it. And then when we came and visited, and actually sat down.
And had the consultation.
Had a consultation, spoke with Mark and Dr. Sam. I started opening up to it.
It's a tough decision.
Yeah.
Right. I mean, that probably, for everyone out there, not just people in the dental community, but specifically patients that don't know about this or never heard about it.
Oh, yeah.
I mean, it's like it is.
I didn't know it was an option, and it was an alien thing. And it still is to a lot of people.
Yes.
What was the big turning point, other than the consultation? What kind of research did you do yourself?
Well, the implants, it's unheard of to do that many implants, 20 implants in one visit, along with all the teeth pulled out with the gum disease and bone loss. Do it all in one visit. I mean, nobody's heard of that.
4 months later. I mean, really.
No one's ever heard of. I didn't even know if he could go through it, but I also knew that we didn't have an option at this point.
Yeah.
It had been, he was sick. He had a lot of infection and he wasn't getting better, and he was starting to have serious issues, and he promised me he was going to do this. So I told him if this is the route he wanted to go, I would support him after doing the research. The research I did was very vague because there isn't a lot of research on it. So I made my decision after we had met and had the consultation.
And we're 2.5 hours away. So we visited with other dentists in Springfield about this, and they were skeptical, and they're not anymore.
It is a big commitment for us, not just the drive and being that far away, but if in order to do this, it's going to be pricey. With us, it was one price, everything included. That helped. Yes, that helped to make up our mind.
Yeah.
We did have an issue where we needed to see Dr. Sam. It was on a Sunday. He opened up,
Bam.
Brought his people in. We were able to get in there on a Sunday. He opened up for us. There's no disappointment here. And now that this is 4 months.
4 months.
And we went and saw Dr. Sam today. Everything looks great. His tissue is healthy. He's healthy. And we're going to do final impressions in August.
Yeah.
Awesome.
So I had the procedure done on Thursday. I was back to work on Monday. Nobody knew anything. My face wasn't swollen. I was still on soft food. Fortunately, I like pudding and bananas and stuff like that. It's a diet you're going to have to, you know, it's important that you understand that you're going to have to be on soft foods for a while. But then I eat perfect now. I had corn on the cob. I mean,
And for me, I got to watch the whole procedure, which was a huge bonus for me. So interesting. And being allowed to watch the whole procedure, I felt like I was not only there to support him, but I was learning and I was seeing all of this with my own eyes and things I'd never seen before. And even now, every time I look at him, I'm blown away. I'm just totally amazed. I can't believe it. I can't believe this option was out there and we were a part of it.
Dr. Sam and his staff, for sure.
Yes.
Yeah.
Talk to me a little bit about, you know, beforehand. You know, obviously you had some infection going on in there. You know, kind of full mouth. It wasn't just isolated. Tell me about that. Kind of how you think it came about, and you know what you're really starting to notice as far as your health went. You know, your ability to not eat really, or your inability to eat.
Yeah.
Also the other health effects.
I had some extractions on one side, so there I was chewing on one side a lot, and you know, I was favoring the one side more than the other, and you know, so you're going to wear those teeth down a little quicker. And a couple of years of that, and I already had a bridge on the bottom, and I was looking at a bridge on the top. And success rate is not long term on that, you know. I think what we decided here was a perfect fit.
The seriousness of his situation is this had gone on. He had braces, he had perio work, he had a bridge, he had
I'd spent thousands every year.
a lot, but
it's not that I was neglecting my health care, because I exhausted my insurance every year.
at the point we were at, he was already starting to have chest pains. He was on antibiotics months and months and months, probably over a year actually. He had been on antibiotics off and on constantly. His eating was very restricted. It had to be something really soft.
No way I could have bit into an apple then,
No.
or something like that. But I hadn't tried that yet because it's only been 4 months. But I feel like we could pull that off. I mean,
His uppers were in such bad shape. He had braces from his eye tooth to eye tooth.
to splint the one that
That
was
was
gonna lose.
holding, literally holding
I was
his
going to
teeth
lose
in.
my front tooth is where I was.
When that wire was cut on those braces, those teeth came out and they were very infected. Since the infection has been gone, he's gotten pretty healthy, you can tell. And
had all my blood work done and everything.
had a
from
full
doctor.
blood workup, perfect.
Who's the cooker out of the family? Which one do you like to cook?
Neither one of us like
I
to
don't
cook.
like to cook,
We
but
eat
I
out.
do it.
We'll come to your house and eat.
How do you think I got so much? The old girlfriend.
We, but it's been a great experience, man. It really has. It's something I can be proud of.
When I watched the whole procedure, and it was extremely intense, I could not believe that he wasn't in incredible pain afterwards. Never did he get in incredible pain. And that blew me away more than anything.
I think I had 14 extractions that day. I didn't count.
20 implants, all the extractions,
in a 5-hour period.
retrimming the bone, contouring everything. Stitches. Oh my God.
It was an ordeal.
Oh my God. And I kept waiting for the pain to hit.
But you know,
the
that
pain
was
to
a
hit,
Thursday.
and it never did.
And Friday, you know,
He's like,
I
I
was
feel good.
expecting something different. And then I said, well, it'll hit me tomorrow, you know, the second or it just never did. It was like natural. It was, it felt comfortable. Kind of.
So after this whole thing, I go back to my dentist that does my cleanings, which he had saw, and she was real skeptical about the whole thing and, you know, really against
She
it.
was, yeah.
Now she's like, give me that information. She couldn't believe it. I showed her pictures
Yeah.
And she goes, I need
It's
to get in
unheard
touch
of.
with him. And so now she wants to research what Dr. Sam's doing, and she said that she runs across patients like him every day, but they have no resources to send them to because it's unheard of again.
Right, exactly. And she's wanting to obviously help out her patients. I mean,
Sure.
those patients need help.
She said there's a Billy Joe that walks in her office every month,
Yeah.
and she can't do any more than she did for him, send him to her oral surgeon and go through all these different steps and be without your teeth.
And that's where I was. I was faced with a dentist, an oral surgeon, and who knows what else. You know, 2 or 3 people involved. Where I went to this place at Huntline, and it was taken care of right then, right there.
Everything,
all in-house.
everything. Not
Everything.
so many different places to go, and it's just all there, all taken care of. Results are great. The people are great.
I don't even think I took pain medicine after we got home.
I don't think he did either.
It went great.
Yep.
So if you were to sum it up in a few words, I mean, you went from, I mean, you were pretty damn unhealthy to now, like literally like a light switch.
Exactly.
Absolutely.
Yeah.
No doubt about it.
Yeah.
No doubt
I'd have
about
had a
it.
heart attack by now, probably.
Or a stroke.
Yeah.
Yeah, he was having
It's
some
unhealthy.
serious issues. That's why he had
Gum
to
disease,
do something.
and like I said, I exhausted my insurance every year. It's not like I ignored the fact that I had a problem. There just wasn't any solutions.
And I was in the dental field. I made sure he got his care. It's just sometimes the problem is bigger than you. And
but it wasn't bigger than Sam.
it wasn't
bigger
bigger
It
than
wasn't too big for
Huntline
Sam.
Dental.
It
That's
just
right.
wasn't.
No, Dr. Sam has been a blessing. He'll
He
always
is
be a
something
hero
else.
to us.
So long story short, this is literally life changing.
Sure.
I'll guess.
I
yes.
think so.
Yeah.
Long term,
Right.
you know, I think I'll get another 10, 15 years out of my life on this.
I'm gonna keep his
Possibly.
teeth when he goes.
She said if I ever left her, she's going to take them. So-
Yeah, you can't leave me. I'll take his teeth.
And that's different, you know, because I've always had a beautiful smile. I thought, you know, I know how important that is, you know.
When he works in the public all the time, and it's not that he's vain being without his teeth, but
No, it is a sign of vanity.
A little
think. I
bit.
mean, because
a little bit. But your speech is affected.
who would
Your
wanna go
persona
without-
is affected.
I mean, they were talking 6 months. Pull
At
my
the
teeth in
least.
6 months
At the
of
least.
healing before I could get any dentures implanted or anything like that. And I didn't want dentures. I want to be able to dive into my swimming pool and not have to worry about it.
Taste
you
your
know?
food.
Run a jackhammer at work and not have to worry about that, you know? Live my life as normal as possible. Yeah.
No.
Do all those normal things that everyone else.
But that,
Eat corn on the cob.
that,
Bite into an apple.
that infomercial changed my life.
And it's kind of funny too that he was in the dare blind when he watched that. But it was worrying on him. And we
Not
had had the
even. I was in
discussion
the
about
deer
his health.
cabin.
We had been seeing these dentists and
That's
the
why
doctors.
when it came on, I
and
just sat put and watched the whole thing. It was
it was to the point where something had to be done. He had to, and he says he thinks better in the deer blind anyway. But I just think it's funny that it's Huntline Dental, you know, hunting, and Dr.
Yeah.
Sam hunts, and here
Yeah.
he sees it. It was
well,
like it was
brought
meant
a
to
certain
be.
confidence to me to have a
Yeah.
person similar to myself.
Yes.
You know.
Right, you could relate to.
Yeah, sure.
And he
I
was
seen
super
it.
excited when he come home, and
Yeah.
of course I shot him right out of the dirt when he was.
Yeah.
Didn't even want to look at it. Just look, he'd say. Just look, and I'm like, yeah. But yeah.
So how did you show it to her? Did you show it like a?
I went to there's several. If you Google it, Huntline
On YouTube.
Yeah, I think it might have been YouTube.
It was
actually.
YouTube. Yeah.
I showed her. I couldn't find the one that I'd watched, but there were several where Dr. Sam was talking to Mark about different procedures, and I showed her that. So I kept trying to show her the one that was relatable to this
Yeah,
guy
it
from New
took
York
a little bit.
that came down, and so anyway, in the meantime, I got her talked into a consultation, and that's really all it took. You know, it's state-of-the-art stuff. I mean, it really was.
Well, Dr. Sam, you can tell when someone has confidence in what they do, and even though it's new, he felt confident that he was going to be able to help him. And
He
that's
took a lot
all
of
we
time
were looking for
to
is
explain and
an option
Yeah.
other than what we had been giving that somebody really believed in, and he believed in it.
he did.
And he made believers of us.
Sure.
Right, exactly.
Yeah.
And that's the whole thing that I tell most patients is that, I get, patients like you guys coming there all the time for a free consult, and we see everything. We could see a single tooth that's messed up, or we could see an entire mouth that person literally is dying from.
Sure.
And we see it all, and anywhere in between. And people come in there embarrassed, their smile and this, that, and the other, and they're like, "Oh, don't take my picture, yada yada." I'm like, first of all,
Yeah.
we see everything, and we've done everything,
Yeah.
and whether we can do it quickly or not, we're going to tell you right up front. We don't
Yeah.
sugarcoat anything. No pun intended. No
Yeah.
sugar on
Yeah.
your teeth, but
Yeah.
we don't sugarcoat anything. Dr. Sam tells you how it is and what it takes to get there.
Yeah.
So I have to tell you, when he showed me the video, and I told him I'd think on it and all of this, so I decided, well, I'm going to talk to this doctor. So I sent an email, and in that email, I just spilled the beans, who I was, what I was wanting,
Her
what my
background,
husband had
background,
seen,
both. Yeah.
was in the hunting stand whenever he viewed this. Just told him the whole deal. And he told me later when we was in the consultation that he never checks the emails. He happened to check it that one time and
And
he
he
saw
called
that.
me
And
at
he
work.
personally called him.
Yeah. Call me.
That was huge right there. That he would take the time, not have a staff member call, but he called.
Because I can take the initiative and move forward, but I need a little coercement sometimes, and she
Again,
wasn't
he
giving it to
believed
me,
in what he was doing, and he followed up. And
Yeah.
And with my background, he knew by what I was saying in the email that I was uncertain about
He was
it.
confident enough to take on the challenge with her background and mine, and coupled together. It's not exactly what I want. If I'm a remodeling carpenter, I'm a carpenter, so I run into problems, I fix them, just like Sam. But I don't take every customer, especially if they have a background in building, it's a little more difficult. And Sam knew the difficulty as soon as he was talking to us about it. He wanted that challenge. He wanted it. So.
Well, and I'm glad he did.
He did a good job.
He's still doing a great job.
So inside of 6 months, I'm gonna
Be in your finals.
be in my finals, and the procedure will be close to.
We still have a little critiquing to do, but not much, and that's
Yeah.
when we do it when we're fitting for the finals and everything. But he said today the healing is fantastic,
Mm-hmm.
no issues. We've had no failures of the implants. And we expected to have at least one. And we should have by all rights with all the infection and bone loss, but we didn't.
Super sterile environment.
Yes,
I mean,
very clean. The
Staff,
other thing,
unbelievable.
his assistants are
Yeah.
next to none. They know what they're doing. They
Yeah.
are on top of it, and they are really like the backbone in there. They really are.
That's true.
Extremely trained. Could not be happier with them.
Personable people.
Very personable, but they know what they're doing. They're very trained and they are on it. And you can ask them any question and they have the
Yeah.
answer. Any question. So that right there shows the doctor's doing his job too. He's got his staff right there on target with him. And they work like a nice, grand team. Everybody
And changing
does what
people's
they have
lives.
to do. Yeah, and changing lives and saving lives.
More likely.
Yeah.
Yep. Yep. Should just kind of sum it up, like what it really means to you, in your words, how it relates to your life, from the time of chewing to
Yeah.
health to just being able to smile again.
Well, it's like taking 20 years off and going back to a 30-year-old mouth, and when things were solid and tight, and, I don't know how it would change my life, really. I mean,
You smile more.
confidence.
You're healthier. You have more confidence.
Yeah. don't have any tooth pain.
He's realized.
I mean,
he's realized that he's stronger than he thought he was because he's not a person with freedom of speech.
And you can cut this if you want, but there's no anesthesia involved in this, and you got to be a tough son of a gun to sit there in that table and do what we did, and as a group.
I think they have anesthesia now, don't they?
You weren't under general. You were, local.
Yeah, just local. Yeah.
He did it the hard way.
So.
You're not knocked out for it.
You're not knocked out at all, and you're, you're feeling it, and you're seeing it, and hearing it, and it's tough, man. I mean, it was tough, but the other side is
pretty awesome. You just got to keep your eye on the prize.
That's right.
Yeah, he was attached to his teeth, and he had he worried about losing them. He'd had them his whole life, Right. And that's something I haven't ever had to deal with, so it was different. But I think he's ever so happy now. He don't miss them.
No. These are better than I had in a long time.
Yeah.
What was the first thing that someone that didn't know about this said to you? Like, when did they start? I remember you told me a little bit of a story. Was it one of your kids maybe said something like that, or someone like that? I think you mentioned.
Well, I know that like that same Saturday or Sunday, I think it was, I went to my son's house. I was feeling great a couple days after the procedure, and my son's girlfriend told me, "Oh, you got your braces off."
Yeah.
And I said, "Oh no, I had way more than that done." And it embarrassed her a bit, but I went ahead and shared it with her. And that was the very first person that I had shared it with, and it was easy to tell somebody. I was proud to tell them. I thought it'd be tougher than that.
What'd she think? Probably blown away too.
Yeah, she's blown away. And there's been a couple of people. I've only shared it with a few people. Everybody just thinks it's business as usual. And Rhonda noticed,
Yeah, and I have friends that are in dentistry.
There was a couple of months there that I kind of laid low.
What?
I laid low a couple of months after the procedure, and immediate family around. And I just wanted to get used to the idea of it and kind of let it all sink in, soak up, And so we started having some social gatherings. It's July now. You've got birthdays, and you're going to the lake and going swimming.
Honestly, if we don't tell them, they don't know.
Nobody
Unless
knows.
they're like our family that we told this was going to happen.
So I've shared it. Anybody that asks, I'll tell them. But it just seems natural. It's like looking at me 20 years ago.
As simple as, did you get your braces off? Oh, I see you got your braces off. They don't have a clue.
But the people that I have shared it with, especially in the dental field, are blown away. They didn't even know that was an option. And a friend of ours, they've known us 20 years. And she's watched me in my smile's deterioration, as it were, and she's tried to help, and Pam, my wife's tried to help, and I couldn't slow it down. I just couldn't stop it. I'd throw money at it, and I'd throw dentist at it, and periodontist, endodontist, dentist, general dentistry, oral surgeons. I've been down the road, man. I really have. One year I remember going to a doctor, dentist, and I had 6 extractions in 1 year. That was huge for me, but I was trying to look for, if I did 6 that year, I could do 6 next year, and I could start putting implants in their place and working my way towards something similar to this, but I didn't know this was like an option.
He always left the dentist never feeling good, never feeling like he was successful, ever.
I never had a long-term plan.
Ever.
But I kept throwing money at it, man, and when I seen that infomercial, I thought, this might be right for me, just to get one and done. Not have to worry about this no more. And have a toothache, man, it's been 4 months since my mouth hurt. That's unheard of.
Unheard of.
Unheard
of.
Just that alone.
I hadn't taken an
antibiotic. And
no
antibiotic.
I hadn't taken an antibiotic this year, not one.
Not since the surgery.
And I'd take 2-3 a day, some most generally for a year.
Yeah, maybe even over a year. It's just so, it was just an everyday
But
thing.
yeah, it's
forever.
if anybody needs help,
One and done.
Yep. Like I said, we see it all the time, you know,
Yeah.
different situations and stuff like that.
Yeah.
But, you know, it's cases like yours where it really is. I mean, you're on a breaking point.
The
Well,
huge
and
thing.
you just don't have time. You run out of time at the end, and you just
Yeah.
you've gathered up all the information you can gather up, and none of it really is helpful to you because there's so many people that has to be involved in collectively, and that's time consuming. You know,
There's going to be a lot of skepticism towards this in the dental community, but I think if we can give a consult to these dentists like I had, it's going to change their, and they see people like this, it's going to
So,
change their
I
whole
had the
outlook and
procedure
give
done
these people a lot.
4 months ago, right?
Yeah.
So I'd
Oh, boy.
still be, if I'd have went to another dentist, I would have had my teeth pulled 4 months ago. I'd have still been sitting here in front of you right now with no teeth for 2 more months. So what was I going to do? Take 6 months off from work? I mean, get a little
And that's
temporary.
just for dentures. That wouldn't have been for what you have,
Yeah.
the
So-
prosthetics you have.
I'm already almost into the healing stage of 100% in 4 months. The other direction, I would have been just now getting into the stage where I was. I mean, I
Doing
just,
impressions for,
I have no idea how that timeline would work for anybody.
Right.
How can anybody face the world?
but people, that's what they're having to do. So that's why this is so important, for it to get out there so they know that there is another option, a safe, wonderful, one and done option.
Yeah, they're tight. They're sealed. It's like oh my God, it really is. You see it, you know,
Yep.
See it all the time.
you see it all the time.
Talk to me a little bit about sleep. Do you sleep any better or sleep any different now that you've had this in?
I really never have thought about that, to be honest with you. I am sleeping good, you know, and I used to have toothaches all the time.
Oh,
so,
you'd be running across the floor in the middle of the night
you
in
know,
pain.
I had a bottle of whiskey pretty close to my
Whiskey
bed.
and pills.
And I hadn't had a bit of whiskey at all this year. I mean,
If he does, it won't be from a toothache.
It'll be a celebratory shot if I do it now. But I mean, I've been troubled with this ever since I was 20 years old. I remember I was super poor. I couldn't afford dental care, but I did the very best I could. But there was 10 years I went without dental care. But you couldn't tell it. My smile was perfect. I mean, it looked good. But I had a lot of hidden problems, and perio was one of them.
Yeah.
So, I mean, I even did a split quadrant back in the day, and that was, you know, I mean, I've been to the dentist. I tried to count how many times I'd been to the dentist, and I bet
He
it was
said a few hundred, but I
bet
don't
it's
think it
o-
was a few
I bet it's
hundred.
100 times. I bet
Probably felt like
it felt like that, and I never had I had a kind of a phobia about it. I didn't really like that, and I've got a gag reflex, and it's not something I want to put myself through.
I think if he would have had results that made him feel like he was accomplishing something when he went, he wouldn't have had that phobia. But every time he knew he wasn't getting anywhere.
Yeah. I had several dentists in my life, and a couple of good ones, but Dr. Sam's the best. I mean, honestly,
Yeah.
he really is
We're very grateful to him for his knowledge.
I'm glad I watched that TV
Sharing
that day. It changed my life.
It was definitely meant to be, and I think it was more than just an accident that he saw it out there in the.
And I hope that,
someone upstairs. was
Yes,
telling me to-
Yeah,
absolutely.
sure.
I'm
Think
telling you,
so.
he was very ill, more so than he even knew.
probably,
He seriously was having heart issues, and he had so much poison in his body. So much.
but it's out there for people. They can take advantage of this just like I did.
Yep.
And 2.5 hours is a long drive, but I'd drive 10 hours for this.
I would too.
mean, if I knew this was in Dallas and it was an option for me, I'd have went to Dallas, you know. Dr. Sam, like I said, was totally relatable to me because he was similar to my lifestyle. So I'm glad I seen that commercial. I really am.
Sounds like you're going to have a better hunting season this next year coming up.
I hope so. Yeah.
Maybe he can hunt with Dr. Sam on one of his
Yeah.
hunts.
My friends from Texas also come up this year, and they
You'll
haven't
see
seen
Bill
my
in the
smile.
blinds.
Yeah. You know, it's I'm proud of it. Bottom line.
Life changer.
Yeah.
It is a life changer.
What do you think it would be like without the implants attached on there and you had to roll,
No,
rather than regular old dentures?
No, I wouldn't do that. I would I mean, if I would have had to went down that road, I would have went down that road. And there's lots of people that have, and they've
I
dealt
don't know
with
if
it.
he would have went down that road. It was that iffy.
I don't know. I mean, if I would have had to, I would have had to. I mean, the problem I had with the dentures is how long I would have had to wait in the healing time. So you just go find your
And his
remote
gag
island.
reflex.
Go find
with
your
the
remote
pellet.
island somewhere and do it. So
I don't think he would have ever, even if he'd have done it, I don't think he'd have ever been able to wear them because he does have such a severe gag reflex.
and you
That
you
in
know,
the palate, it would have never worked.
and covering your palate, you lose all taste of food. So, I mean, as you get older, there's only a few things you got left, and taste of food is really important to you. You know, and I'd lost that with my oral health that I had in the last few years. I couldn't eat right. I couldn't taste food right. I couldn't chew. I couldn't, you know, everything was different than it is now. And right now, I'm just now getting to where I can really firmly bite on stuff for the last month, and I've got more confidence in the last 2 weeks than I had 3 weeks ago. And so every week, I'm gaining a little more confidence. So, and I'm already chewing steak or anything I want. I'm eating popsicles, ice creams, and any
He hasn't
tougher
been into
food.
an apple yet, but that's coming.
Yeah.
That's coming.
I'm looking forward to peanut brittle. I mean, it's been about 20
He
years
loves
since
peanut
I had
brittle.
peanut brittle, and you know, later on I'm gonna try that. So
So those implants, I mean, that's the foundation. That's your 2x4, the stick frame of your house.
yeah.
That's holding everything together.
Hmm.
And I cannot believe
And the thing is
with
you
the
know,
shape he was in, we didn't lose
so
at least
you
one.
put in 20 implants or what have you, and not to lose one. And Dr. Sam is behind that because his professionalism and his install was flawless. I mean, he done his homework. He explained to me how he did that. He lost sleep over this. He was into it. He was tuned into me, and I was tuned into him. I told him if he performed it, I would keep him clean. I've kept him clean. So he's done his part.
So speaking of losing sleep, so above number 8, his front tooth there on the right, he had so much gum loss there. Of course, when the wire came out, the tooth came out and all that, he was worried because he didn't see how he was ever going to get that void closed in. And he really, really wanted to. So he did something he had never done before, made an executive decision, and he drilled a hole into the prosthetic.
Prosthetics.
And he stitched the gum tissue to the prosthetic.
In a couple of places.
Yeah, a couple of stitches. He had never done it before. And I think that is what really made the difference, because when you look at that now, you barely can ever tell that there was even an issue there. We were talking about that today. Unreal. So the sleep that he lost was a good thing for him.
Yeah.
And it's also something that he's able to help other people with
Yeah.
too.
And since then, I think he's repeated that procedure
Yes,
a
he
few
said
times.
he has.
And
So that was like incredible on its own.
he's like a genius, man. He really is. He's working for a genius. I'm not
Yeah,
kidding.
where was he when I was working? Oh.
Right. I mean, that's the really interesting thing about it is because you've been in the dental field for how many years?
30.
Right. And you've never seen
I've been retired for 5, and no, and everything Dr. Sam was telling us and what he was going to do went against everything I was ever taught. And we all know in dentistry, you know, it changes. and it changes pretty quick, but that was huge.
And it may be common practice in 10 years.
I hope it is.
You know, and I think it will
It makes me want to come back and work in that, because not only do you have this type of result, but just seeing it and being a part of it is like nothing I can even describe. It was wonderful. It was really wonderful.
On your end, it might have been
Well,
wonderful.
that's what I said on my end. I know. I was
That was
into it,
tough.
loving it, and you wasn't.
But I'll tell you what, it really is. It is life-changing. It really is. And it really hadn't hit me yet. I mean, it's still relatively new, and I'm still focusing on how we went through all that. I mean, we made a decision first part of this year, and we went for it, all of us as a group. And it just seems like a blur, and then here we are.
And again, as a group, you're not alone. Whenever you're with Huntline, you've got everybody. Yeah. You've got Mark, you've got the assistants, you got doctor, we got
called, the 2-3 days into it, and Sam answered the phone, and it was his daughter's birthday.
Yeah.
I mean, how cool is that? That you can call a man on the weekend on his daughter's birthday.
On a cell phone.
And it might have been, you know, something is minute to him, but it's very important to us, you know. And he made us feel confident and gave us a structure, a foundation that we could count on.
Yeah.
Yep. So the next step from here, like you said earlier, is to kind of get, you know, your final impressions done.
Mm-hmm.
For that, we're gonna make a little modification to the actual flaring of it and whatnot, so it fits you more naturally to how it used to be.
Yeah.
And from that standpoint, you know, you've been kind of in control of the look and feel of it. You know, you get to pick the color of it, and
sure.
Hey, I want this brighter, I want it darker.
Yeah.
You know.
Yeah.
You
know, it's important that you know, you're going to have to age your teeth a little bit. Because, you know, my boss, he said, "Man, those are just too perfect." And as soon as he seen them, he said, "Those are just too perfect." But you know, a couple of months have been by, and a little bit of wear, and they look a lot more natural now than they did then.
When I first saw the teeth, they had him laying out there when he was in there to get his procedure. I looked at them teeth, and I looked at him, and I picked them up, and I thought, this is what we're paying this for? And Dr. Sam come in, and I said,
they're deceiving when they're
Dr.
laying on the bench.
Sam, you know, is this the teeth? And he goes, yeah. He says, they look a lot different when they're in the mouth.
Yeah.
Lo and behold, when they went in, they looked great. But at first I was like, so nobody needs to freak out when they see them teeth laying there, because they, and of course it's not the finals, but
Yeah.
oh my God, I was so impressed. So impressed.
Yeah, I think so too. And yeah, the finals are coming in a couple of months. A few tweaks, and he listens. You know, we could leave him just like this and it'd be fine. But I told Dr. Sam that I thought that maybe, and he's open to it. He's not just shut you down and say, no, that's not right. Education teaches me different. He listens to you and say, well, we can do that. And he's easy to talk to, isn't he?
He is. He's a good listener.
That's one thing I tell everyone, is that it's truly custom.
It is truly custom.
We don't go to the shelf, grab something, and throw it in your mouth. It's built specifically for you.
Yeah.
So I mean, that's where the...
Well, you do an impression of what you had before, so it looks super similar to what you started out with. It's just you're taking 25, 30 years off your smile and put it right back in. And it's totally functional. That's, you know, when you're young, you don't understand. You're biting an apple and you throw the core away. You never think about eating that apple at all. You never think about one bite of it. You just eat it and chunk it in. And, you know, you do now. You know, a lot of people wouldn't bite into an apple at 50, 60 years old. You know, they got to really think about what they're doing. But they're confident. I'm confident with my teeth now. I can eat anything, you know. He said I could eat beef jerky. I hadn't tried that yet. I know I could.
I mean, we just don't think about his teeth every day anymore, but when we do think about them, it's still, it's like it hasn't really totally registered yet. It's just, we're still in awe over it.
I can't believe it.
I'm still like waiting for the pain to set in. honestly, and it's still not happened.